This video aims to give you more information about radiotherapy for lung cancer at the Northern Radiotherapy Network. Whether you are coming for radiotherapy in Middlesbrough, Carlisle or Newcastle, the treatment you receive will be standardised across our network. It is just the location and the setting that will be different.
Lung cancer has always had a reputation as being one of the more aggressive cancers, but actually it's one of the cancers at the moment that's got some of the most effective treatments for it that are coming through. So the technology that we're now using to treat lung cancer has allowed us to give much higher doses to the cancer with fewer side effects. So we're curing more patients with radiation, and the drugs we use alongside radiotherapy are also much more effective even than just 5 years ago. So actually the number of patients we're curing with lung cancer is going up significantly. I've never been involved in a more exciting period of cancer treatment for lung cancer, and we're continually improving. And we're very lucky in the Northeast to have access to all the latest equipment and all the latest drugs and technologies that we need. So there's reason for optimism.
What is radiotherapy? Radiotherapy is the treatment of cancer using high-energy X-rays. The aim of radiotherapy for lung cancer is to try and cure the cancer or control it for many years. For lung cancer, external beam radiotherapy is used, which is radiotherapy from outside the body using a radiotherapy machine. Your consultant will detail and explain the options to you about how we treat the cancer, while protecting healthy tissue and reducing side effects.
We are so targeted now. We use really high precision radiotherapy. We're very fortunate within the network that we've got all the technology which allows us to conform. So basically we can shape that beam of radiotherapy so we target the tumour volume to a high dose and minimise basically the dose to all what we call the critical structures across the chest, and that does help minimise the side effects as well.
Planning a course of radiotherapy treatment is very important because it ensures each treatment is given accurately. Your treatment is planned by a team of radiographers and dosimetrists under the supervision of your consultant. The planning scan involves the use of a CT scanner to identify where we need to treat. A CT scanner is a donut-shaped X-ray machine which is used to take pictures that the team use to plan your treatment accurately and to target the area that needs to be treated. This procedure takes about 10 minutes and is completely painless. The therapeutic radiographers will have checked the referral from your doctor and they will ask you to confirm your consent. They will also explain what clothing needs to be removed and help you achieve a comfortable position, which you will repeat each time you attend for treatment. Keeping still for the scan is very important, so if you are not comfortable, please tell the radiographer and they will try and make some adjustments. During the scan, you will need to lie in the same position you will be in for your radiotherapy. To ensure you are always in the correct position for every treatment session, we will make some permanent marks, the size of a pinpoint on your skin. These tattoos show where we need to direct your treatment.
So these permanent marks are very small. They are placed on you in a stable position that doesn't move. So they may not necessarily be exactly where the treatment is going. People often think it's X marks the spot. It isn't that. It's just a standard place so we can work out how to get you into the exact treatment position. We then need to get you in the same position that you were in when you had your planning scan, because everybody's radiotherapy is customised. Your plan is unique to you. So we need to ensure that we can get you back into that position that you were in when you had your scan.
A team of radiographers will treat you. You will be asked to lie on the treatment couch, and the radiographers will use the skin marks to position you in the right place under the treatment machine. Treatment times are usually very quick. You will be in and out of the room in about 10 to 15 minutes. Most of this time is preparing you, like getting undressed and positioning you. The treatment itself only takes a few minutes. You will feel no pain or discomfort. We ask you to breathe normally and to keep as still and relaxed as possible. You can play music during your treatment. This can be your choice and can be played into the room. Most machines make a noise. This lets you know the treatment is taking place. You will be alone during your treatment, but the radiographers will be able to watch you and listen via an intercom and closed-circuit camera system.
You'll then be brought under the treatment machine, which looks like an arm that comes out of the wall and it won't touch you at any point. You'll hear the radiographers calling out an array of numbers and measurements. You can just ignore us at this point, and that's just getting you into the exact right position to deliver the treatment and acquire the scan. Once we're happy that all our checks have been completed and that you're in the right position, we'll then head out of the treatment room, and you will be alone at this point. However, we will be watching you all the time over a CCTV system, and we also have an intercom system so we can talk to you as well. The machine will then move around you several times. You'll also feel the bed move ever so slightly just as we get you in exactly the right position based on that planning on that scan, and then we'll deliver the treatment. There will be nothing to see, nothing to feel. The only thing to hear will be the music in the background that will let you pick. And it'll probably take the whole process 10 to 15 minutes, but the time you're alone in the room is usually more in the region of 3 to 5 minutes.
Side effects of radiotherapy treatment for lung cancer may start over the course of your treatment. They may continue to get worse after treatment finishes, and then will gradually improve over the next 1 to 2 weeks. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for lung cancer for more detailed information.
We've got a fantastic team. We support you all the way. You're seen by the clinical oncologist, you're seen by specialist radiographers, that we are very proactive to keep those side effects at bay and to intervene with medications if we need to.
Following your treatment, your health professional will talk with you about what happens next. And you will continue to have tests for monitoring.
Patients need to be aware that at 6 weeks, that first contact is really about just making sure you've got over the side effects and everything's settled down, but they'll need ongoing follow-up. So in terms of knowing whether you cured a cancer, you can't tell on that first scan. You have to do repeat scans over a period, usually 3 to 5 years. Usually I say to patients, if you get beyond 3 years after what we call a radical or a curative treatment, hopefully you're out of the woods at that stage. But obviously 3 years is quite a long time.
We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know, and please don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.